All right. Hi, y'all. I am here with my friend Dillon Barron, who I met through the amazing Molly Hewitt at Warren Wilson College. He's from North Carolina, but he's now an emergency medicine physician in Chicago. Wow. So thanks for talking to me today, Dillon.
Yeah, my pleasure. It's fun to talk about myself.
Yeah. And before we start talking about the pandemic and everything happening in Chicago, just briefly, just tell me a little bit about how you went from what led you to Chicago working as a physician.
Yeah. Well, first of all, thank you for having me. This is really fun. I get to talk to my friends about coronavirus, but in my experience as a doctor, but I haven't had a ton of opportunity to sort of formally talk about it. It's kind of in a way, I've been excited because it almost seems like therapeutic to talk about all this.
Excellent.
But yeah, so we both know Molly. We went to high school together in Charlotte. Then I went to Duke, where I kind of thought about going into advertising or even graphic design, but then I just settled on pre-med. And so then I went to UNC for med school, and I knew I wanted to do emergency medicine just because it's super fun. I'm like an adrenaline junkie. There's a pretty good lifestyle with it. Believe it or not, and you get to help people from all walks of life, like poor people, homeless people. It's kind of a good cross-section, and so I knew I wanted to do that, and sort of on a whim, I didn't know much about Chicago, but I knew that it had really good trauma, and it's the second biggest urban center in the U.S. It's New York, LA, then Chicago. But out of all three, Chicago's still sort of a grungy city with people that need help. It's not New York where there's a million rich people. Ditto for LA. Chicago just kind of stuck. And then I met my partner here and bought a house, got a dog, and still here.
All right. Excellent. Cool. Yeah. Cool. I've only been to Chicago twice, but I had the best time both times I was there. It's just so freaking cold. That's the only thing.
You got to come here in summer. Summer's the best.
Yeah, I need to. I think I did once in summer, but I went once in the winter. So jumping into that, so I just, before I was chatting with you, briefly reading about what's going on with COVID-19 in Illinois, I saw that Illinois is now the state with the third highest number of cases after New York and New Jersey. So since COVID-19 hit the states, and specifically Chicago, how has your work changed? Has things changed for you? Yeah.
And actually, so New York has a higher incidence, so more per person, but our county, Cook County, actually has the highest number of positive patients in the country. So there's a lot of it.
Oh my gosh, right.
Yeah. And I was talking to my mom right before this, and I said, yeah, I'm interviewing with somebody who lives in Australia, and they said, why would they want to interview you? And I said, because they don't really have coronavirus there. And I looked it up, and it's just like a different world compared to how it is in the US. I looked it up. You guys have had 100 deaths. I personally have had 100 deaths. So.
Oh my God. and you've had it yourself, which I also want to ask you about too. So
I can dive into that. But I can tell you my experience. So I remember it hit sort of Seattle, which was the first place, and people kind of just wondered what was going to happen. The president was saying, I think this is going to die out, which I think everybody hoped or believed. And then it spread, and I think there was one day where everything shut down and sort of everything changed, the NBA, the NFL, every group event. And I remember just kind of, I had this anxiety attack where I called my mom, not a real anxiety attack, but just very anxious. I called my mom, it was kind of, there was this 48-hour period where everybody realized that this was going to be a thing. And I think it was, what really predicated it was there was a study from a big consulting firm in London, I think it was, that predicted 2 million deaths, which thankfully that never happened. But it was very scary.
Yeah.
And so then it was kind of we waited. In Chicago, we watched as everything sort of went down in New York. I have a bunch of ER doctor buddies that work in New York, and that was very, very traumatic, I think, for them. They had a much, Illinois, while we have the third highest number of cases, we've done an okay job of flattening the curve. They didn't have that.
Okay. Right. Right. So your hospital, did it have this situation, or with you hearing about graves being dug at rapid paces and not having enough space to accommodate everyone, did that type of thing happen?
So 100%.
Yeah.
So there was a week where we just kind of waited for it to hit Chicago. And then once it hit so hard. There was about, I would say, 3 weeks where I just literally, I would have like sort of an anxiety attack, like once a shift, where it was just every 5 minutes, there'd be another EMS run, like a coding patient's coming in, like coronavirus. We weren't so bad as New York, where it was like people dying in the waiting room left and right.
Yeah.
But I felt like there was about 3 weeks where I always felt like I was one more patient away from being overwhelmed and unable to for us to say, like, we just don't have the resources. Thankfully, that's coming to a close.
Good.
But yeah, it was bad for about 3 weeks, and I didn't know how to get through it. And I thought if it gets worse, I was going to say we won't get through it. So
was it like, as you guys waited, and like, it sounds like the waiting was just as like intense and traumatic in some ways for like, but was your hospital like, were you preparing extra beds or like making plans, or was it like, what was the protocol there?
That was one of the nice things. Unlike New York, so New York just got hit. They didn't really have time to prep.
Yeah.
We had a week to 2 weeks to start making ventilators.
Okay.
We had new materials that were made so you could put multiple patients on one ventilator at the same time, up to 4. And we had time to get PPE. We had lots of legislation that was passed. Illinois has a really progressive government compared to a lot of other states. And so they made lots of progressive policies about how you would sort of treat coronavirus patients, which was nice. But I mean, you can do all the prep in the world, and then once it happens, like, you're still sort of you're still in it, I guess.
Yeah. So you've had over 100 deaths just at the hospital where you are.
Oh, more than that, I'm sure.
Really? Okay.
Yeah.
Right.
The whole hospital.
Right. Yeah. Right.
Yeah. I'm sorry. I just gotta.
No, that's okay. That's all right.
Yeah.
That's all right. And what is go ahead.
It got to a point where normally, and this is something I think has been adopted by a lot of countries and states and things like that, but normally what you do is you have something called a DNR and a DNI, which is the do not resuscitate, do not intubate. When somebody's family says, I just want to make them comfortable, like, this is grandma's, this is like her time, this is her time to go home to Jesus. But normally that's always the patient's responsibility or the patient's family's responsibility. And the state passed legislation where now we as doctors can say, like, I'm sorry, your grandmother's dying. Like, this is just, if she passes, we're not going to do all these terrible things to keep your grandmother alive. But she's going to die anyways, which is kind of one of the more sort of bizarre things that happen. But if that makes sense.
And I guess I've talked to a few different nurses and doctors and stuff like that, and they were saying that, or just nurses, you're the first doctor I've spoken to, but I guess you have the situation where you must have really strict protocols around like who can come in and stuff like that to try to contain it. And I guess you probably have a very specific thing like to not spread it to your partner and stuff like that. You guys have a lot of, or did your partner, well, you've already had it. So actually yeah.
My partner got it as well.
Oh, really? Tell me about, what, how did you get it? What happened?
So to answer your first question, there are really strict policies. No, that's okay. There are really strict policies on trying to limit exposure. But especially in the ER, it's just, it's kind of chaos and people are everywhere. And a lot of patients you don't know have it until you find out they have it. Their chief complaint is like, I'm vomiting. And you find out later that they're vomiting because they have coronavirus. It's kind of insidious in that way.
So it's not a dry cough or anything like that. Like, it could be completely.
Yeah, people present in sort of all, we found that, most of them present with the classic, cough, fever, shortness of breath. But people have presented with kidney problems or vomiting or like an upset stomach, things like that. And so in the ER, you try your best to keep yourself protected when you can, but you just, you can't. It's a small room and everybody's breathing and doing the same thing. So I actually don't know where I got it from.
Right. Right.
I mean, no way of knowing. It could have been in the community. It could have been from a grocery store. The most likely thing, allegedly the most dangerous thing we do in terms of transmission is intubating patients, where you put a breathing tube in them and put them to sleep, which is the sort of the mainstay of treatment, the only treatment really for end-stage coronavirus patients. So I'm sure I got it from that. I didn't know I had it. What was it like? So for me, it was fortunately not mild, but I'm fine. It started out with a runny nose, which I kind of didn't make anything of. And it was during a time when I was supposed to be out of town. So I had 2 weeks off from work anyways.
Okay.
And then, you know, I looked it up and it said runny nose. That's a really rare symptom of coronavirus or COVID-19. And so then the next day I woke up and I was kind of feeling achy and just kind of crummy. And the next day I woke up and I was like, I feel like help. And just was like, so just like sore and just felt crummy. I never spiked a fever. And I would say after about 3 to 4 days, it went away.
Right.
My partner's only symptom was the inability to taste and smell.
Really?
He never got anything beyond that. Yeah. So he had a really mild case.
Right. In some ways it's gotta, I wonder now, because I'm so glad it was as mild as it was for both of you. Is it easier to kind of, sorry, there's some surprise questions here because I didn't know what you were going to say. So, so do you feel, in some ways, I feel like if I were in the US, I would almost feel relieved after I got it, if possible, because then it's like you don't, like, if you go to the grocery store or anything like that, like maybe you don't feel like you have to wear a mask. I don't know what is that like?
Oh my gosh. We both feel so relieved that we've had it already. I have friends who are like, God, I'm so jealous. Like, but that being said, it's important people, you know, you can get antibodies to the flu, but you can get flu every year. You can get antibodies to a cold, but you can still get the cold every year. I think the evidence points to that. You can't get it again based on the fact that places like Italy and China haven't had a second wave. Which is really lucky in some ways. But I still wear masks. And a part of the reason that I still wear a mask is because, especially like as an ER doctor, I feel like I should be a good example to other people.
And I guess they're still learning so much about it. So that's interesting. So I guess do you think that it's when you talked about your anxiety attacks and stuff like that, like do you feel like in some ways were you worried about getting it, and do you feel like you're able to be a better doctor now that you've had it, or you're less anxious, or
I think I'm overblowing anxiety attack. I don't think so.
Okay, all right.
I'm just very anxious, sorry. But no, like I'm an anxious person. I think I was more anxious about hearing about people's accounts from Italy that I'm sure you read about in the news and New York. And being in this situation where you just feel powerless. I think that was more anxiety provoking to me. As a healthy 30-year-old, you know, the evidence is overwhelmingly that I would be fine. I kind of assumed as an ER doctor that I would get it at some point. And I think all ER doctors did. That being said, I think it's important. My parents, for instance, they don't wear masks because they say, you know, we're healthy. But I see plenty of healthy young people come in who are stage coronavirus. And who, you know, go on to die and things like that. So.
Have you seen young people die from it? Really? Really? Like how young?
I think the youngest I saw was somebody in her early 30s.
Oh my gosh. Right.
Yeah.
Right.
And so it's kind of no predicting.
So. And from some of the nurses that I spoke with, I think some of the hardest things might be that, like, because there's not a cure, there's only so much you can do. Right? Like, I don't know.
It's a very weird, bizarre disease. I mean, there's no treatment really. For young people, we do what's called, and this is rare, but we do what's called putting them on ECMO, which is extracorporeal membrane oxygenation, which is basically where you take all their blood and you divert their heart and their lungs and you put oxygen in it for them and you give it back to them. And then you hope that if you do that long enough, their lungs will heal. But once you're on a ventilator, I think the data is an 85% mortality. So once you're on a ventilator, it's pretty grim. It's pretty done.
Oh my goodness. Right. And are you seeing it? And if you need to check your emails or anything like that, we can.
Sorry.
No.
No, it's totally fine. I know you hear the beeping in the background.
Yeah. I definitely don't mind. We can pause it and probably even edit it out if we need to. So I'm just like, is your boss calling you like, we need you to come in?
Yeah. That's me.
Okay, cool. Right. So is it, but you said it's now slowing. So I have just read a article in New York Times that said that overall the US is still, it's not, the cases aren't increasing, but they're not decreasing. Is Chicago getting better? Do you feel like, or in your hospital, do you feel like things that you've noticed a drop in people with it?
Yeah, for sure. 100%. So it feels like we made it through the storm. If you look, there's a curve. Chicago is like kind of at the far end of the curve now. Like we're definitely downtrending. I think the pattern has been that it kind of migrates from like a big place like Chicago out into the smaller suburbs, and it just keeps migrating out to places that it hasn't been. So right now, I think it's finally starting to hit the southeast in the south. Is kind of like one of the last places where it hasn't really hit. But thankfully here, it's come down a lot and we haven't seen much. I think people are really concerned with all the protests happening.
Talk to me about that.
Yeah.
What's happening in Chicago outside of the hospital? What's it like? Yeah.
I mean, I think the protests that are happening are important. I think it's hard to tell somebody not to protest. And I'm not going to tell somebody that, but we as ER doctors, so I went to a protest 2 days ago. I went by after work. I just wanted to stop by. I haven't been able to participate in them much just because of my work schedule, which is annoying. My boyfriend's at one right now. But I got there and, it's thousands of people. And we were texting as a group. We said, if any of these people don't have coronavirus, all of them do now. And so it'll be interesting to see how that goes.
Yeah,
TV, I guess.
That is an interesting thing to me because when I saw the early protesters demanding to reopen America, I was like, they're going to lose Trump's going to lose his base if all these, and now I think it's important as well, but I do hope that that people are social distancing. I saw one in South Carolina and I was very impressed by how many people were wearing masks and keeping their distance. Do you feel like that's happening?
Most of the people I saw, everybody was wearing masks, I would say. Chicago, like I said, it's a progressive city. And so it's illegal to go to stores or wherever without a mask. And actually, we just started to reopen yesterday. So everybody's wearing masks. But there's only, especially in Chicago, some of these protests are thousands and thousands of people in 100 square feet or whatever, I guess. But
so if one person had it, statistically, it'd be very easy or if one person takes off their mask and starts shouting, then it'd be pretty easy for it to spread.
Migrate around.
But that's interesting that Chicago is just now reopening because like South Carolina started reopening a few weeks ago, I think. So
very different politics happening and also very different population densities. I think one of the more interesting things I read was the coronavirus has become really politicized, which is kind of weird. I don't think anybody was expecting that. But it was a New York Times article that pointed out that places that vote Democrat, which tend to be more pro-safety measures, pro-mask, also tend to be big cities where everyone's sick. And South Carolina, there just aren't that many people and the population density is low. So if one person gets it, the odds of them giving it 2 million people are low.
And it's also warmer as well, which they don't know that there's any connection there at all. I know Brazil is like the worst country with it. And that's full of like tropical regions and stuff like that. But so it's hard to even comment on that, but it is something. Like I think we're all still so unfamiliar with it. And that's really interesting that legally you're required to wear a mask. Is that all over Illinois, do you know? Or is it just in Chicago or?
So it's, God, I don't know the exact
that's okay.
laws on it. It might be that the the mayor might be saying that she recommends that all businesses have this policy. I don't want to say for sure. I know that basically every store that I go into, grocery stores, whatever, have a mask policy.
Right.
Like you can't go without a mask. I don't think it's the whole state of Illinois.
Yeah.
I'm pretty sure. I think it's just a recommendation.
Yeah.
And I think that's how it is for the bulk of the country.
Yeah. And it just depends on where you are.
Yeah. I mean, big cities, there's just the high population density, so you're just kind of high risk to get sick and pass along and whatever.
Yeah. And I have been watching, I just want to talk a little bit more about the protests, because that has been a really interesting, powerful, also sad, epic thing that has happened within all this. And I almost feel like I should do like a more concentrated interviews about this happening too. But I feel like compared to what I'm seeing, some of the more violent, I saw some there has been a bit of have they been peaceful in Chicago for the most part, or how do you know?
No. I mean, for the most part, yes, they've been. For the most part, by far and away, yes. But there have been. God, edit that part out. I'm just kidding.
No. Yeah.
So I would say by far and away they've been peaceful, but there have been violent days, and I think the first day was a violent one, and I think it's hard because none of us as Chicagoans, Chicago citizens have tons of pride in their city, and they hate to see it ransacked or burned down.
Yeah.
But they also understand. I've heard people say, a decade of silence didn't do anything. Now I feel like I need to, or I'm entitled to lash out. That's my right. There was one day I would say of bad violence. And then after that, it's been, sort of here and there. And I think the more people look into it, the more they're finding that these are just one-off people who are trying to profiteer this bad situation. They're really not defining the movement. It just happens to it's getting a lot of press. The downtown area of Chicago is still closed. You can go in for business or if you live there, but it's called the Loop. It's kind of like the Manhattan of Chicago. And you can't get in there unless you live there or have business there, which is where a lot of the looting was, a lot of Versace stores and stuff like that.
Right. Okay. Right. Interesting. Well, I was curious because, a lot of people love to bring up Chicago when they're talking about crime and violence in the United States. So, but some of the things that I'm seeing, I guess it depends on where you're watching. You can look for anything to justify your narrative, on the internet. But for the most part, I have not heard as much about Chicago as I've heard about Atlanta, for example, or even Louisville and Kentucky and stuff like that. But maybe, I just started reading looking for Chicago headlines this morning before I was talking to you. So,
that's okay.
Yeah. But it's interesting.
That Chicago gets kind of a bad rep. So, like I said, we're the second biggest population dense city in the U.S. That don't include LA. New York is an extremely wealthy city. It's an extremely wealthy world city, whereas Chicago is a city for Chicagoans. And so if you look at the amount of crime for our population density, it's actually on par with, it's a little higher than some other cities, but it's pretty on par with most places when you look at crimes per capita and things like that. It's just that we have so many people that it artificially looks elevated. And then also, I think, in other cities where there's lots of violence, the point of these riots is, people lashing out against their government in some ways. Chicago's a really progressive. We have the country's first and only gay Black female mayor.
Oh, wow. I didn't know that. Okay. Right. Right.
So it's a pretty cool, progressive place. And so in a way, when people lash out against their government, to me, that's at least how I feel. I don't know if that's true, but I feel like we're in some way, we're united in a way. So.
Right. Cool. Interesting. And I think, and we'll see how this, and this is just the beginning, like we'll see what happens as this progresses. Like you're in the middle of it being a doctor in a pandemic, but also in the middle of a protest in a important city in America. So yeah, there's a lot of things that will, like, it'll be interesting to watch this in a year's time and see how things have changed. Yeah. Interesting, cool. So thanks for telling me a little bit more about that. I wanted to talk to you a little bit more about your experience with giving blood. So you have COVID-19 antibodies, which evidently is something that can be really helpful for coronavirus patients. But you're also a gay man, and gay men in America can't donate blood. So first of all, I'm curious, how does COVID-19 antibodies help people, and also why can't you give blood?
Sure.
Yeah.
And I'm not a infectious disease doctor or a scientist, so I don't know exactly how they help. And it's never something that we would be giving in the ER, but intuitively it makes sense, right? Like your body uses antibodies to fight diseases, specifically viruses. And so, and part of the reason that coronavirus is so deadly is because we have no antibodies to it. This is a novel virus. So like a baby, if they get a cold, they get high fevers, they get pretty sick. But then for the rest of their life, when they get that same cold, it's just a runny nose. They don't get fevers, they don't get really sick. And that's why it's important for babies to encounter all these diseases so that they build their immune system. So again, coronavirus is so deadly because this is just a new thing. Nobody on the planet until this emerged had immunity to it.
Yeah.
So it makes intuitive sense that if you gave antibodies from somebody to a patient that's suffering a disease, that those antibodies would help. I think anecdotally, it's proven to be effective. These studies take a long time to show like a definitive result. But that being said, I think at this time it's, there's lots of therapies that are still being tried. Preliminarily. So like Plaquenil or hydroxychloroquine was the one that got a lot of attention, even though it turns out it didn't help. There's a new one, I think it's called, it starts with a D, I can't remember. But I think antibodies are still one of the most effective. And so that's sort of the science, I guess, behind it, or the thinking behind it. In terms of gay men donating blood, so it dates back to the 80s is my understanding. I've tried to do some research on it because I'm trying to sort of lobby or do whatever I can to change this. But it dates back to when, there used to be a much higher prevalence of HIV, particularly among gay men, and the testing used to be very inefficient. The testing now is really sophisticated, and the incidence is low enough in gay men that it's a different world. And so in some ways, I think the law is like a vestige of the past that just nobody's had the guts to change. Up until coronavirus, the law was, it used to be that if you've ever had sex with men or if you identified as a gay man, you could never give blood. And I can't remember that changed, but it changed so that the new rule became if you're a man who's had sex with men, an MSM, if you've had intercourse with a man in the last year, you couldn't donate blood. And that includes if you're married, if you're in a committed relationship, if you're monogamous. Politicians, progressive politicians, one of the biggest ones was Kamala Harris, who's a presidential candidate. And I want to say Alex Ocasio-Cortez, I'm not positive. But they lobbied it to get it temporarily lowered to 3 as like an emergency measure during the pandemic. And
lower to
great.
3? Lower to 3.
3 months.
Okay, right.
I've had intercourse for 3 months.
Okay, right.
But right now it's written as a temporary measure that's supposed to fall off when the pandemic's over. And really, if you look at statements from groups like GLAAD or the Human Rights Campaign, it's still a discriminatory policy because it's based off of identity as opposed to practices. So like under this policy, I'm in a committed relationship with my boyfriend. We haven't been with other people for 5 years now, but a woman, for instance, who is having sex with tons of partners, unprotected, and engaging in lots of high-risk activities still could. And there aren't those kind of like screening questions, I guess.
Right.
And so people say that that's a form of discrimination, which is how I feel.
Yeah, yeah. Because you said you tried 5 times to donate, and they've still.
Well, because it's not that individual. So if you look on the websites from places like the Red Cross, they actually all lobby against it. They say they agree that they think this is discriminatory, it's unfair, it's harming patients, most importantly. It's depriving people of a life-saving therapy. But it's actually, it's regulated by the government. It's a law.
Ah, okay. Right.
So until that's changed, they can't really do anything.
Right. I'm so glad you kind of posted about that, because that was something that I was really unfamiliar with. And I think it's an interesting kind of example of kind of smaller policies that we don't always think about, that can be potentially prejudiced, and also stop people from having life-saving help as well. So
I was shocked how many of my friends didn't. I wrote it when I was like a little wine tipsy, and I was in a bad mood. I wrote the post. And I thought about taking it down, but then I got such a reaction, and I was shocked how many of my friends didn't know about it. So and I'm curious to hear what like other countries have, like if Australia has policies like that.
I think I looked it up a little bit later. I don't think the US is alone in it. And I might even, when I write the post, I'll mention exactly what the policy is in Australia too, because I don't think Australia is quite, it might have a similar policy, because I think I actually saw it somewhere else. I saw it before I saw you comment on it, and I was like, okay, this is something people have been talking about. So it's an interesting time lots of things are going to be affected by this pandemic in so many different ways. We're going to see so many different things come up that we never expected, I feel like, and some are going to be sad, but some could potentially be good as well. So, I guess to go back to just, this comment of like how we can help people, and you're helping people as a doctor, but also by giving blood and being compassionate and donating money and things like that. What do you think? And I have been so concerned about the American healthcare system. Seriously, because I mean, I talked to a doctor in Canada, a nurse in Canada, I talked to a nurse in Scotland. I do know that in Kentucky, everyone can, I think, and actually most of the US, everyone can get tested for free now for the virus. But
the American healthcare system, as you know, is a disaster. It's bad. I mean, I talked to my mom right before this, and she was like, there's no way they only have 100 cases or 100 deaths in Australia. That's just like not possible. You must have gotten the wrong number. And I said, no, like, I mean, I think that's true, unless I'm looking it up wrong.
No, that's true. It's like 103, I think, 103. So it's just over 100. So.
Yeah, and I know you guys have major cities, but then a lot of the rest of the country is less population dense, but you do have you have big cities, like you should have more deaths. And I said to her, like, this is what socialized medicine does. Like people can afford preventative care, they can take care of themselves, because all the deaths that we're seeing here are from people who have bad chronic disease that's been unmanaged, like bad hypertension or diabetes or whatever. So it is, I too worry about the American healthcare system, and maybe this will be enlightening in some ways. There is allegedly free testing, and the government has talked about forgiving medical debt for people that are diagnosed with COVID-19, which is a whole other can of worms. People are unclear on if that's true, if it's not true, who knows? That already be seen. I don't have a lot of trust, I would say. I'm not optimistic.
Right.
Things that people can do, you know, I think as doctors and healthcare workers, we've gotten tons of credit and tons of like support. I don't know if you've seen, like in big cities at 8 p.m. every night, they like start clapping. It's awesome. It's cute.
So they clap for you?
I guess. I mean, moved on to something a little, different. But I feel like I've gotten the recognition I deserve. I think I saw like a meme or something. It was a post that was about other essential workers, like trash collectors or grocery store people or postal service people. and how, you know, we don't consider them essential in the way that we pay them in terms of how minimally they're paid until now all of a sudden they're heroes and deserve X, Y, and Z.
Yeah.
That's one of the ways that we could, like you were talking about, make positive change out of all this.
Yeah. Yeah.
Talk about elevating people that like keep our society afloat and paying them accordingly. I think if I were to put my money or put my efforts towards lobbying something, or I think those people deserve the same amount of recognition that we're getting as doctors and nurses and things like that. So.
Yeah, and it is an interesting and challenging thing with it is that everyone who works on the front line, it's important and it's amazing, and they deserve our respect, but they also didn't sign up for that to the degree, like, you know what I mean? Nobody, when you decided to get a job as a grocery store worker or a post officer or something like that, you didn't know that there was going to be a potentially deadly pandemic that you could be. So I do think it is frustrating because it's like, yeah, let's recognize them, but also like, let's protect them as much as we can. Are they getting all over the country? Are they getting masks? Or they have bosses that are looking after them, and let's pay them better as well. So yeah.
I saw some article that I think I saw it today or yesterday that said the country's billionaires got $600 billion richer during the pandemic.
Yes.
It's despicable. Like,
yeah.
Even I, as a PR doctor, taken a pay cut during all this.
You've taken a pay cut. Really?
Yeah.
Why? That seems so ridiculous.
So much money going out of the healthcare system and none going in, you know? But
I thought that like people like healthcare workers were getting, if anyone was making money right now, it was healthcare workers. Like I've heard about like doctors and nurses being like, like chartered in from other places and getting paid like insane amounts of money, right? So you actually have taken a pay cut during the pandemic.
Yeah.
Wow.
Yeah.
Wow.
The system is just so strange because they're spending so much money taking care of these patients. And if you think about it, the thing that pays for our healthcare system in the US is things like expensive surgeries, like knee surgeries, shoulder surgeries, cancer surgeries, and all those have been canceled. And so there's really no money going into the US healthcare system, but there's a ton going out in the form of oftentimes unfunded, uninsured coronavirus patients. And
could you just explain that? Because I do have people from Australia that will watch this. So what is, if someone is uninsured, how does it work? If someone who does or doesn't have health care insurance, like I actually don't understand this fully either. So I mean, I lived there and I had health insurance and I still didn't completely understand it. It's a very complex and convoluted topic, but yeah, it's a massive machine that makes no sense.
If an uninsured person presents to the ER, we have a law called, I believe EMTALA is the law that covers this, but says that we have to see patients who present to the ER no matter what, regardless of their ability to pay. A primary doctor or a surgeon doesn't have to say that. If you go to a primary doctor or a surgeon or something like that and say, my knee hurts, they can be like, you don't have the money, I don't care. But if you come to the ER, we have to see you no matter what. And so in that way, the ER is the safety net for the US. It's not our insurance system, which is a problem for all sorts of reasons. One of the biggest one being that people can get preventative care, they can just get therapeutic care. So we only see people for complications of their diseases, not presented parts of their diseases. But so let's say they need to get admitted, let's say they go to the ICU, let's say they get intubated, you know, their hospital bill would be in the tens of thousands, hundreds of thousands, whatever it needs to be. If they have assets and they're not insured, the hospital can choose to go after them and say, like, send them to like a credit agency, collections agencies, things like that. They can go after them in court, etc. If they're an undomiciled or homeless person or somebody who's got super limited means, most hospitals do have things like charity care, where they will just offer to waive the bill, XYZ, although that's hard to get. Most of the time they'll just say this person doesn't have the assets for us to go after them, like in court or whatever. If they're homeless, you can sue them. What are you going to sue them for? And so they'll just sort of let it ride.
Right. So that is so interesting. So basically you can get worse and worse and worse and people can turn you away. But then once you need a life-saving treatment, you can get it. But if you had care earlier on, then it might be far less expensive for the system.
Exactly.
And then taxpayers might end up paying for it anyway if they don't have the funds. Right.
Exactly. Which is why people in the US, they don't like, especially conservative people, they say, why should I pay for somebody else's healthcare? But they don't realize they are.
Yeah.
And which is all why we have by far and away the most expensive healthcare system in the US. Or not in the US, in the world.
Yeah.
Obamacare was supposed to fix that, but that went away.
Yeah. Is it completely gone? I think people can still sign up for it, but they've hacked away at it as much as they can, I think, right?
So Obamacare was just enrolling people on Medicare and Medicaid, which is the government insurance plan.
Yeah.
And basically what Obamacare did was it said it was mandatory for you to have insurance, whether it was private insurance or the government insurance policy. And if you didn't enroll, then you paid a penalty. Yeah.
Okay. But that is like, you don't have people, you have fewer people with that type of Medicare now, or it's no longer mandatory.
It's no longer mandatory.
Right.
So the problem is, if you're healthy, like if you're you or me, and you don't have medical problems, I don't know if you have medical problems, but if you don't,
I'm fine.
It's your advantage to say, well, I don't need insurance. Like, why would I pay money for it? And so the pool of people getting insurance are sick people and people that need it. And so as a result, insurance gets more and more expensive.
Yeah. But I do think that is maybe potentially one thing that things have been made very clear that even if you were a healthy person before, people without pre-existing conditions have been seriously affected by this virus. And we are now seeing that it is to everyone's advantage to have healthcare. Although I'm sure that plenty of people could find a way to argue that, but I do hope that, I don't know, it would be great if we could just restart the healthcare system in America after this somehow. I don't know. I don't want to take too much more of your time, Dillon, but I guess with everything that's going on, we're in a dark space. Do you find any silver, like the whole world is, America is, like, are you finding any room for hope? Are you doing okay? Like what, personally, like what are your thoughts about the world right now and moving forward and stuff?
Yeah, I'm optimistic. I have my low points, but I think that nothing that's meaningful or impactful is ever easy. You probably feel the same way.
Yeah.
It's hard to change. And, in terms of coronavirus, I think some good things will come out of it. I think it's a tragedy, obviously. Ditto for what's going on with the race riots, the protests. I found some TED Talk that I showed my boyfriend, who's really upset after after a protest. And it was just how, like, we forget that the world, it was this TED Talk that was highlighting how the world's becoming a better place. Like, if you look at like all these measures of quality of life and the quality of the world is getting better.
We don't think about that, but actually there are some, like over the last, couple hundred years, even though we always see the worst things, there are ultimately things have gotten better. Which is hard to say, which is hard to think about, but it's important to remember right now, isn't it?
I think 100%.
Yeah. Is there anything else you want to include before I let you go? Anything else you want to say?
Not really. It's been fun talking about this.
Yeah.
I get a chance to talk about a ton, but just to like kind of fully vent. So.
Yeah. Well, I really appreciate so much everything that you have done and are doing, Dillon. Thank you so much for doing that.
Of course. Yeah, my pleasure.